Hi, I am Dr. Serdar. I am metabolic and obesity surgery. Today I would like to introduce one of my patients. Her name is Clare. Clare is 52 years old and his weight is nearly 190 kilos and her body mass index is 75. We did her operation 4 days ago and now she is here and answer to my question. Clare, what is the effect of obesity on your lifestyle?
It affects every part of my life, from waking up to going to bed. I was in pain all day and having difficulty just carrying out normal daily tasks.
Yeah.
And I didn't see any future if I didn't do something about it.
I see.
Okay.
Clare, why did you decide to have obesity surgery?
Because I was in pain every day and I couldn't lose the weight, I couldn't exercise. I hurt my knees and my back, everything was sore, so I couldn't help myself to lose the weight. I needed help.
What happened when you come to our clinic?
My husband booked with your clinic over the phone and we arrived in the airport. We were collected just outside the airport, brought straight to the hospital. We were made very welcome. We were given our room, shown around, and we were told that the next day, because it was early in the morning, the next day that the doctor would come and see us and go through the procedure. The next morning I went and had lots of tests to ensure that I was okay to have the surgery and that it wasn't dangerous. X-rays, bloods, ultrasound scans of my heart, various different things they need to know then. All that information was taken to the doctors. I had a meeting with my doctors and between us we decided the best surgery, the best way forward. And then it was all went and had my surgery and all went very well.
Clare, what was your recovery life after surgery?
Okay, so when I woke up, I was in intensive care.
Yeah, first day.
We had discussed that it would be better for me to be in there for the first night, and I was monitored the whole night by 5 different doctors. I had minimal pain because of I had pain relief the whole time. I didn't feel sick, or I was as comfortable as I was expecting to be after the surgery. The next day, I was taken back to my room to finish, continue my recovery. Again, I was monitored all the time. Doctor came to see me several times. The nurses were in checking on me all the time, and I had my pain meds. I had anything that if I was uncomfortable, anything that I needed. I was on intravenous fluids because I couldn't eat or drink at that stage. I was uncomfortable, but it was manageable because of the pain relief. Then, sort of towards the end of the day, I was allowed to sip water, which I was very scared to do because I thought it would hurt, but it didn't. And the dietitians and the doctors explained very, very well how much I can have and when I can have it. And because my husband was here to help as well, it was very comfortable and not a scary or frightening experience for me. The third day, I was allowed to take more water. My pain relief, I am not in any pain really, except maybe just a bit of gas pain. And again, I had my fluids, I had all my medicines intravenously, and just continued to drink and taking a little bit of broth and just managing my tummy very, very slowly. But all the staff were very attentive and they made me feel very comfortable and safe. I knew that everything was under control and they looked after my husband and myself very well.
Thank you very much. Clare, the last question is, would you advise the people like you think about surgery?
Okay, I would advise definitely to think about surgery. It seems like an extreme thing to do, but the reality is that if you're in a position like me where you can't help yourself, you need a tool, you need something to help just get started. And the surgery was so straightforward. The place is lovely, the people are lovely, and it isn't anything to be scared of. And every part of it is explained to you from beginning to end, every bit of your recovery. And when you go home, you're given information and backup. And I do think that in a position like me, I would certainly advise to think seriously about starting your weight loss with surgery.
Clare, did you learn any Turkish words here?
Oh yes, everybody says geçmiş olsun, which means get well soon, as perfect word. And
another one?
Teşekkürler ederim.
Teşekkür ederim.
Serdar Bey.
Tamam. Çok teşekkür ederiz biz de sana.